Regarding chondrosarcoma, it is a carcinogenous malignant tumor affecting adults, commonly in males, 4 to 7 decades. Different types like primary, which can be a low-grade, high-grade, or dedifferentiated. Secondary osteosarcoma can develop in multiple hereditary exostosis, osteochondromas, or Ollier disease or Maffucci syndrome. In older disease, the incidence is 25 to 40%, while in Maffucci syndrome, the risk nearly reaches 100%. The multiple hereditary exostosis has a risk of 10%, while solitary in chondromas, it's less than 1%. X-ray will show metaphyseal lesion, can happen in the flat bones, has a popcorn sort of appearance, or sometimes a lytic lesion, poorly defined. The clear cell chondrosarcoma is slightly different. It happens in epiphyseal region. It can involve the proximal femur. Majority are low grade and do not respond to chemotherapy or radiotherapy. So the surgery is the main line of treatment. The surgery is wide surgical incision. The prognosis for the low grade tumor is 90% for 5 years survival and 20% to 30% in 5 years of survival of 5 years in high grade.